I'm Joe Clarke, the Olympic champion. I've come today to have a little treatment. At the moment I don't actually have any injuries, which is great, but I have been told from the physio that I do have a very tight thoracic spine and I have less range of motion in my right shoulder than my left, so we've done a range of motion test and we've got some treatments hopefully.
Yeah, great. This is a good case for using the Shockwave device pre-injury, so to speak, to avoid injury. So range of motion in your sport is of course extremely important, and I think it's a good idea to try fascia and muscle release, myofascial release, but also to work with your spine using the SPINE-ACTORs from Storz Medicals.
Yeah.
So let's have a try.
Yeah.
All right.
Thank you.
And you do a good thumb upwards again. The same there. This is also limited.
Yeah.
All right. So let's take to the right side. SPINE-ACTOR. So this is actually aiming towards the joint. You can use it to mobilize the joints.
Yeah.
You can also use it to treat the muscles on each side of the spine. But I will use it to mobilize the joints. And this should be pain-free, almost. It's quite comfortable. It's more, I don't know if you tried high velocity manipulations when somebody's crapping, which could be a little bit painful. This is a lot more comfortable.
Okay.
And I would say it's inside the safety zone in all times.
Okay.
While if you're not experienced, this could actually be dangerous to do high-speed velocity manipulations, but this would be perfectly safe. When trying to mobilize the joint, I will use low frequency because I don't want a reflex response from the body. So I will use the low frequency as maximum 3 Hertz. I might go down to 1 or 2 as well, but 3 I would say. Bar-wise, you can start 1.5. That's okay. Like that. The region, just like that. So I will palpate with this just to. Now I want a joint, and I will just stay there for. This feels okay.
Yeah.
Yeah, good. All right, some hits like that. Then we'll see. There's another joint, and I will try to maximize the movement in this region. So this is in an extension position. You have to try to get the right angle, which is approximately 60 degrees to the joint, to get the joint moving. Like that, and then we'll try. There is the joint as well. Still comfortable?
Yeah.
Good. All right, so we'll change to a flexed position. So you have the same position with your arms, but we'll flex your body like this, and then we'll try to do the same thing here. Be a slight different angle. Oh, we had a reaction from the muscles. A little twitch. Still comfortable?
Yeah.
Good. This would be the joints as well, I think. You see there's a twitch in the muscles, but it calms down after a while. So that's okay. Like that. So this is quite easy. It doesn't take a lot of time. You can take down your arms. And what we're aiming to is to get a reflective response from the muscles around the joint, but also from the joint capsule itself, just to relax. All right. Let's see if you flex now and see if we can get any more movement. All right. So we increase the movement. I would say down there approximately. It's still a little bit stuck in this region, but I will try to treat a little bit more. But then you have to lay prone.
Yeah.
Let's see if we can use this. There's actually quite a right movement. This is a bit stuck, and this region as well, I would say. Is it related to any pain when I do that? No, good. All right. This is more in a neutral position of the joint, so we're trying to see if I can reach a little bit deeper down when the muscles are relaxed. Still have a little bit of twitch here. Okay. see if we have any difference in outcome. Then you can sit up again.
Yeah.
Then we'll continue with the fascia applicator, which will probably generate another part of the movement, right? Okay, a little bit better actually. Okay, now we're going to continue with the fascia. So what happens if I passively do like this? Let's put your thumb facing upwards like that instead. And now it's a little bit intense. So this is probably the weak spot, the tight spot. I would say this region here. Not too bad here, but in between this would be. Yeah. Is this painful or is it? It's okay. All right. Can you rest your arm like that? All right. So now I put the fascia in a semi-tensed way. So it shouldn't be actively tensed. It should be in a stretched way like this. That would be better results for the fascia, I think. Now we use the knuckle disc applicator, which is my favorite for fascia treatments. This can be a bit painful, but it should be bearable for you. So let me know if you think I should increase or decrease the energy. So I'll put the hertz up to 10 now. And I won't use any gel, so it will be a bit sticky against the skin. Yeah. Just so you know, right? Feels alright?
Yeah, fine.
Okay. You will probably have some nice color on your skin afterwards.
So it's working.
Yeah. So this region here slides a lot easier. I don't know if you can feel it, but there's less friction right here.
Yeah.
While if you compare to this region here, there's a lot more friction.
Yeah.
And this is one of the reasons for the tightness, I think. Here as well. Yeah, here as well. A little bit here as well. The posterior part of the deltoid muscle, there's a tight fascia as well. Okay, so now it's actually sliding quite a lot easier here.
Yeah.
So I think we've got a result in this region. All right. Let's see. If you put your arm like this, just to see what happens. It's a little bit tight here as well, so yeah. I'll probably work here, but I'll work 90 degrees to the fibers like this. That's try to work in this fascia here, which is obviously a little bit tense. Oh, sorry. Lower frequency, lower the energy to 1.3. I reset the counting system, so like that. That's a good setting. So how does this feel compared to the posterior parts?
Similar.
Similar. Yeah.
That feels a good one.
Yeah, yeah. Because you can see on your skin here that it's a little bit tight, this region here.
Yeah.
Right there. And this is where it's a bit stuck.
You can feel it the muscle firing, or trying to fire.
Alright, alright. So now it slides a lot better now. So
Yeah.
that's quite a fast result. Alright, great. Let's see if this fascia as well needs treatment. So you can put your arm just like that, and I'll just squeeze it like this, and I can work in this direction.
Yeah.
This slides really nicely. Let's see if I work a little bit more up here. This is quite similar to other types of treatments when it comes to fascia release, which is very popular today. The big difference is that I can put my settings in the machine to recreate the same treatment every time. I know that I have a certain pressure, I have a certain frequency, so it's a lot easier to control the treatment, because I tend to, if I use my fingers, if I'm in a good mood, maybe I will be stronger and put more pressure, and if I'm in a bad mood, maybe or tired, I will do another completely different treatment. But when I use the Shockwave, it's easier to standardize. Right, so this region here seems to be a lot more flexible. Alright, so let's see how it works now. Looks very nice. That as well. Alright.
Even more on this side now than this side.
It's better, but it's still a little bit.
Yeah, I don't think you can change it like.
No, of course not.
Good.
Yeah. Right. Okay.
Thank you.
So that's good work.